Hi, it's Dr. John Shea here again. Anyway, I wanted to share with you or talk to you about something that maybe I've held off. I didn't want to really talk about. Actually, most men don't want to talk about this. And that topic is erectile dysfunction. We don't want to admit it. It's unfortunately something that can make men feel less of a man. It's shown that men are more depressed when they have erectile dysfunction, when they can't function correctly. It's caused anxiety, a lot of problems there. So anyway, it's an important topic that we sadly don't talk about enough, and yet there are really great solutions. So I'm going to share with you what all this is about. So erectile dysfunction, though, is it just about having an erection? Yes, it has to, you can't have an erection, but the point is erectile dysfunction is you can't develop the erection hard enough for penetration, and you can't sustain it long enough to complete the act of the relation. So anyway, that is something that occurs at different levels too. So it's not that you just can't have an erection. It can be different degrees. It could just be harder to come, slower to come on. It could be that it can't get hard enough. Doesn't fill completely, so you don't have the same size. And then the other thing is that it can't stay hard enough to continue in the act of intercourse. So these are things that bother men a lot, and it is on an epidemic proportion. We're not talking about it that much, but it is occurring. And so I'm just going to come out and say, yeah, men experience that. I'm 52 years old now, and so I'm in that category where this can be very prevalent among men my age, but even before that. So I was actually surprised and shocked when I found out that even by men in their 30s could have erectile dysfunction, especially by men in their 40s. Up to 30% of men can have some form of erectile dysfunction. At least that's reported, and there's many that are not talking about it. By age 50, about 40%. By 60, about half the men have some erectile dysfunction, and 70, and it goes up. 60% or more of men have the erectile dysfunction. This is not because of any disease or anything specifically. This just is something that occurs. Of course, having other illnesses, diabetes, all those things can add to that. But it's probably on epidemic proportion just because of what's going on in our environment, the foods we eat, the chemicals that are out there. I mean, even BPA is a chemical. It's found on receipt paper. It's on lining in aluminum cans. So BPA is actually has an estrogen effect. It's like a xenoestrogen. It can have an estrogen effect on men. Lavender essential oils. Well, gee, that actually kind of suppresses testosterone and kind of helps boost estrogen. That's not good. And then you have the genetically modified foods. Soy is a culprit. There's a lot of things going on. I mentioned BPA, water bottles, little plastic water bottles you get at the Costco's, the Arrowheads, whatever those things, those plastic bottles, BPA. And BPA leaches into the bottle, especially if it's been sitting in your car for a while, if it's getting hot or warm. There's stuff that's in that water that you don't want. And there's plenty of studies showing, the evidence showing that the estrogen effects are in that water. And for men, that can be just really bad. So that's just part of it. And then we have the inflammatory diets, the deep fried foods, the high sugar diet, everything that can also affect blood flow. So blood flow is necessary to have a normal erection. And so there's a lot of things going on. And some years ago, a company came out with a drug they called the blue pill, Viagra. They got rushed through the FDA based on one study showing that it could have an effect on it. It was actually a failed cardiac drug, and they said, hey, this could affect the erection. They started giving it to men, and I think it was, I don't know, a couple years ago, I remember the count was over 1,200 men have died from taking Viagra. And the thing is, it's not always effective. It doesn't always work when you take that pill. So what are men to do? So this whole erectile dysfunction is an issue. The other thing is maybe you have no problem with the erection, but you want just better performance. And so how can that be improved? Well, there are actually things you can. The solution to that is the same as our treatment for erectile dysfunction. And so there's several things that we can do on it. The biggest thing we're doing is something with shockwave therapy. It's this focused shockwave. It's using a device like this, and this device here, this part of the handpiece here, sends focused little shock waves into the tissue. Now, it when you feel it, you don't feel much. It's like a little kind of like a massage, but a little bit sharper in the pulses, because each pulse is a shock wave. It's kind of like the shock waves they do for kidney stones. And I don't know if you know about that, but sometimes you have these people, I've seen these, they used to put people in these tubs and they would send these shock waves. Now the shock waves go through the water and your regular tissue doesn't feel anything, but the stone becomes shattered by that shock wave. So that's like a different, larger scale of the shock wave. This is a little focused. And they've used this type of treatment to help with improving blood flow, with reducing scar tissue. In areas we can reduce cellulite because of the scarred collagen that's clumped together that helps to remodel to become smoother again. So this treatment actually is able to restore blood flow. So that is one of the main causes of why there's erectile dysfunction. We just don't get the same blood flow going to that area. So anything we can do to increase the blood flow into the penis will give you a better erection. And so we're struggling with all these things, whether it's the hormones, whether it's narrowing of our arteries due to cholesterol and plaque formation and just aging. But this treatment, it's also branded ZWave, so you can find us on ZWave, and they have a lot of information on the ZWave site. It's spelled GAINSWAVE. And there's a lot of useful information to find out about erectile dysfunction and the treatment and how it can help. We also combine that with something that some people call a Pshot. It's actually an injection into the penis of platelet-rich plasma. Now, the type of platelet-rich plasma makes all the difference. Not all PRP or platelet-rich plasma is made the same. There are these basic kits that they sell to doctors who don't understand the process and they just want a quick way, and it's actually a very low concentration, weak form of PRP. In our definition, it didn't even qualify. I had to reject this company that wanted me to have an exclusive in Pasadena, and they wanted some type of vampire. It was a vampire lift, vampire face, all this stuff, and I looked at it and said, that is not, it doesn't qualify to what PRP is in my book, at least in my studies of what the concentration and the quality of the platelets needed to be at. So that was rejected, but people do that. People use that. They sell all the time as PRP. It's not the same thing. It's not what we do here. Our concentration of the platelets and the quality of it is at least about 5 times more potent than those. But back to the top again, we do special injections of PRP. They're actually not painful because we have a very efficient and effective way of anesthetizing the areas of the penis, and the injection of the PRP in the penis helps it to restore its function even more significantly than ZWave by itself. So in mild cases, ZWave by itself, people already notice improvements. Some people swear they had benefit right away after one treatment. The official word on that, and for us, that we don't want to overclaim things, is that we want you to give it a month. As you're doing the treatments, within a month, the blood flow is improving, the function and the ability to have an erection and maintain is improving. In more advanced cases, and there's the way we scale this, there's a little questionnaire that we determine to what degree the erectile dysfunction is. But in more advanced cases, it would be great to add the PRP to it. The Pshot, some people call it the Pshot, but we've had people report not just immediate improvements, but also increase in size. One person even said 2 inches increase. I didn't personally measure it, but that's what the patient came back and said. I had 2 inches improvement. So I don't know if there was just such poor circulation that they never saw their potential, and this allowed them to reach their potential, or if it actually also helped it to gain in size. And I would expect actually a combination of both, because the regenerative properties, the growth factors, and the PRP can have that beneficial effect. So basically, that's erectile dysfunction. It's very prevalent in men. You don't have to have erectile dysfunction to get this treatment that we use to help people with that. You can just use it to have increased performance. And we have young men or older men doing it for all the same for all those reasons. So erectile dysfunction is something we don't like to talk about too much, but it's something that we can really make a difference. And I think in today's society, I think people are opening up about it. We do see a change. We do see men more willing to come in and admit they have this issue. And again, doctor-patient privilege, this is all very private. We do have men here. Just because you see men here in our office doesn't mean they're here for erectile dysfunction. Sometimes they're here for their skin rejuvenation. They could be here for their knee joint. They could be here for their hair. We use PRP for those things to help prevent the hair loss, to help restore it. So many different things. One other thing I wanted to add to all this was the treatment that we do using this shockwave therapy to help improve blood flow. And I mentioned that it helps reduce scar tissue. And so it is actually also used in Peyronie's disease. And that is something where the penis has scar tissue. And there's a problem. Basically, it's scar tissue causing it to have a painful erection. As it starts to fill with blood, because the scar tissue, it's pulling on one part of it, so it could cause the erection to go crooked. The penis is scarred on one side, so it can't straighten out correctly, and it could be painful. And it could be just really disheartening to have that, because the penis doesn't have a correct erection. And that can be caused by injury and other things that have happened. So this treatment, we call the ZWave, actually helps to break up that scar tissue and help restore it to normal elasticity and function. So we can help with Peyronie's disease, and we also use PRP to work with that treatment. So I wanted to just make sure I added there. And so no embarrassment there, no judgment by us here. Really we just our mission is to transform lives to the glory of God, and our core values are to just, the golden rule, treat people as we want to be treated. So looking forward to meeting with you all. For information, you can check our website. Like I said, in general, you can look at ZWave, look at our website. Our office, Rejuvu website is rejuvau.com. Phone number 626-441-8968. And we do offer phone or Zoom call consultations, as well as in person. If it's in person, we do screen temperature, we wear a mask, everything's sanitized. We have a reduced number of people in the office. There's no waiting rooms. You go directly to your rooms once you come in. And so we take all those precautions. And we've been helping a lot of people through this time. So look forward to speaking and meeting with you soon. Take care, be well. God bless.